Hi there, Applied AI Summit. We're so excited to be here and tell you the story on how we built ScanX Embrace. For those that don't know, ScanX Embrace is an AI application that we built here in-house at Scan Health Plan to generate medical-grade summaries. We think it's particularly interesting story because we discovered context engineering before it became mainstream later this year. We're not going to give you a presentation today. Instead, we decided to share our story on how we created ScanX Embrace. But when telling you our story, we're going to tell you how to perform context engineering to get clinical grade summaries from LLM. My name is Sardeep Giran. I serve as a Director of Integrated Case Management at Scan Embrace. I oversee our care coordination efforts across institutionalized setting, including assisted living, boarding care, skilled nursing facility. My role focuses on ensuring our members receive timely, high-quality care through collaborative, multidisciplinary approach. With me today, I have my colleague, Mr. Stephen Wise. Mr. Stephen, if you could please introduce yourself.
Hi everyone, my name is Stephen Wise and I'm the Artificial Intelligence Product Owner here at Emerging Technology Department at SCAN. In short, we create AI applications for our internal teams here at SCAN Health Plan. I'm also the context engineer for this project and I'm very excited to show you a method that I have developed that has brought us tremendous level of success when working with LLMs in a healthcare setting. But first, I'd like to send it back to Sardeep to tell us a little bit more about SCAN and our Embrace team.
Thank you, Mr. Stephen. SCAN is a nonprofit Medicare Advantage health plan which serves over 300,000 members across 5 different states. It was founded in 1977 in Long Beach by 12 determined seniors who were fed up with the fragmented care. Their vision led to a creation of the nation's first social HMO, which eventually evolved into a Medicare Advantage plan. The next phase is I'm going to discuss Scan Embrace. Scan Embrace was launched by Scan back in 2022. Scan Embrace is a care delivery asset of Scan Health Plan, serves over 3,000 members across 2 different states where the member requires the highest level of care. We deliver personalized care through mobile on-site clinical services, meeting the member where they live in assisted living, boarding care, and skilled nursing facility. Our mission is simple: to provide 24/7 personalized, accessible, transformative care delivery with dignity, compassion, and clinical excellence. Right. Every day, our team receives 50 to 100 clinical records from hospitals, SNFs, home health agencies, specialists, amounting to over 5,000 pages that have to be reviewed manually. This wasn't just time consuming, it was unsustainable. Staff were spending most of their days summarizing record totaling of hundreds of hours every year. Manual reviews became a bottleneck. We had a burning desire to reconnect with our member to fulfill our mission of delivering high-touch care. Embrace led the way. Embrace became the pioneer of the solution. We were not alone. Many departments across Scan Health Plan face similar challenges. How do we extract what's relevant from hundreds of pages of clinical data? In early 2024, Dr. Waterman, Dr. Kroimans, and I reached out to our emerging technology team with a bold request. Could they build a software solution to automatically generate transition of care, skilled nursing facilities, and home health medical grade concurrent reviews? The project was ambitious. We knew if successful, it could transform the lives of thousands of members. Even more, the technology could be scaled across care delivery asset, amplifying the impact across the organization. This wasn't just a tech upgrade, it was a fundamental shift in how we deliver, turning hours of manual work into minutes of insight, freeing up our team to focus on what matters the most, our members. But the journey wasn't easy. We faced unexpected challenges, technical hurdles, workflow redesign, change management behavior. At one point, I suggested to Dr. Waterman, Dr. Koremans, and emerging tech leader, Ms. Corinne, that I think we need to stop this project. We spent months with very limited result. Then everything changed. The MTech team introduced context engineering, a breakthrough that unlocked full potential of our vision. because at Scan, innovation isn't optional, it's our honor and our mission. We don't just solve problems, we set new standards. In early 2024, our team at Scan Embrace faced daunting challenges. Our patients' chart came from multiple sources like hospital settings, skilled nursing facility, home health agency, specialists, each with a different format and structure. Only 30% of the PDFs were OCR compatible. The systems was attempting to generate summaries from unreadable files, and worse, it was hallucinating, fabricating false data in clinical summaries. For 6 months, we tested relentlessly. I was burned out, frustrated, and stuck. Despite introducing AI to AI testing to ease the load, the LLM still failed to produce clinical reliable summaries. We were ready to shut it down, even scheduled a project to be sunsetted. Then, out of sheer desperation and curiosity, we stumbled upon something that changed everything. At the time, in April 2024, we didn't have a name. Today, it's called context engineering. This breakthrough didn't just fix a problem, it redefined the solution. It allowed us to guide AI with precision, structure, and clinical relevance. This transformation, review time dropped from 30 minutes to just 10 minutes per record for the case managers. We wanted our AI concurrent reviews to do more than just summarize. We wanted to capture the most relevant clinical information from hundreds of pages to support seamless transition of care. By surfacing key insight from hospital SNFs and home health records, our goal was to empower case managers to act swiftly, effectively coordinate care, reducing the risk of readmission and improving the outcomes for our members. It's about precision, it's about impact, restoring time to members that who we deliver care for. Staff regain time to coordinate care in real time, collaborate with families, facilities, and improve transition of care. This wasn't just a tech upgrade, it was a care transformation. We didn't just save time, we restored purpose. We didn't just fix a system, we reclaimed our mission. This is embrace. This is context engineering. This is the future of care. Here with me today, my colleague, Mr. Stephen Wise from Emerging Technology Department at SCAN, who will walk us through context engineering turning hallucinations into healing. Mr. Stephen.
Thank you, Sardeep. I'm so excited. Before we get into context engineering, I'd like to take a moment to talk about the back end of our ScanX platform. In our pre-processing phase, we route all PDFs through the OCR pipeline, including image-only files. And then using Azure Document Intelligence, we separated images from text and passed images down as markdown text. Initially, ScanX Embrace was built on OpenAI 4.0, and we had to break the files into smaller pieces to match the limited token window, causing it to lose context between chats. Moving to OpenAI 4.1 in April with the 1 million token window generally improved our output. However, simply setting things up was not enough, as Sardeep was mentioning earlier. OpenAI LLM and Azure Document Intelligence are not out-of-the-box solutions. This was when the real frustration began. It was not until we introduced context engineering and the PTO method did we get the results that we wanted. At the time, the term context engineering did not exist, as Sardeep mentioned. It was simply called prompt engineering, and the back end of an LLM was not considered when prompting. Our project today is possibly one of the first projects to utilize context engineering in a medical setting. So what exactly is context engineering, and how can you use it to improve your output when working with an LLM? My method for context engineering began from my understanding on how reasoning models work. In short, LLMs are looking to provide the best statistically correct answer. Thereby, it came up with the PTO method, short for persona, task, and output, and also because I told myself that I'll take a PTO once I got ScanX Embrace to work. The method forces LLM to provide the most statistically correct answer where I needed it most, the clinical data. My early work was on ChatGPT 4.0 with a rather small context token window and very large medical records. This forced me to really keep my prompts short and concise with as much static text as possible, given that I had limited reasoning power from GPT 4.0's autoregressive model. I was getting the results I wanted in small sections, but when running the entire JSON prompt, the LLM would begin to make mistakes as it would max out on its context window for my use case. The release of GPT-4.1 in April allowed me to run my entire summary all at once without having to chunk my data. Given the PTO method was originally developed for an autoregressive GPT trying to get it to reason, when we switched over to GPT 4.1 with the reasoning model out of the box, it took my output to clinical grade level. As I mentioned, my goal with this method is to constrict the LLM to where it matters most. My favorite place to start is the persona, because that is the fastest and shortest way to constrict an LLM. It's theorized that OpenAI has several 100,000 AI agents in the background ready to get activated whenever they're called upon. While this may not be true, I'd like you to imagine it that way when picking out your persona. This is a technique. Ask yourself, if I was hiring a professional AI agent to do this task, who would be the expert at it? I know that OpenAI was showing off their health bench score and bragging about how they had specifically trained GPT-4.1 as a physician. For this reason, I set my persona to be a physician, as that is the best imaginary AI agent for the task. Even though the correct persona and context according to prompt engineering courses is a case manager at a Medicare Advantage health insurance company, we are considering the back end of the technology when creating our persona prompt. In addition, the consumer of the output is the physician. Therefore, I have also changed my persona to better represent my end user, which is a physician. Your LLM is going to need an action verb in order to operate. Task is where you get to set that up. Initially, the team was wondering why a lot of important information was missing from the AI-generated summaries. Upon inspection, the task assigned to the LLM was to summarize the medical charts. No wonder, that's what the prompt engineering courses at the time were teaching. Assigning your LLM to summarize a medical chart will produce a different output than if you were to ask it to extract the information from a medical chart. In summarization, the LLM has to decide what to include and what to not to include in the summary, and the LLM may get it wrong. Instead, task your LLM to extract the clinical information. From there, you can add additional prompts, instructing it on what to add and what not to include to customize your summary to what your team is looking for. Task is also your opportunity to kill your LLM's creativity in order to get a more predictable outcome. Do not infer, interpret, or summarize beyond what is documented is an example of a good prompt to include that would force your LLM to think more within the box. This is also the section where you want to instruct your LLM to respond with no data available. This will help prevent it from hallucinating an answer, as LLMs feel compelled to always provide an answer. So please go ahead and tell your LLM, give it an out, and have the option to say no data available or that it doesn't know with every line of prompt that you introduce. Next, we have our persona. Now that we have our persona and task set up, now we come to setting up our output, the most important section. For this section, we're going to utilize a fill-in-the-blank technique so as to assist the LLM with providing the best statistically correct answer for where we need it most, the clinical data. As you can see in the above example, our nurse had written the vital signs in the following format. We want to get our LLM to produce the same results as our nurses. If you take a look at our prompt, you will see that as much static text is used as possible. Where the clinical statistics live is where we leave blank to give the LLM the opportunity to focus on providing the best statistically correct answer there. From there, as you can see, the AI summary matches what the nurses had written. And we did that by achieving that following prompt. From here, test using your LLM as a judge and keep adjusting your output prompt until you get the output that you want. You can leave persona and task alone. Just get really detailed with your output prompt. And congratulations, you have gotten an LLM to give you clinical grade medical summaries custom tailored to your organization's needs. We have used this technique to create customized home health, TOC, and SNF summaries with all sorts of sections, such as hospital progress notes, labs, wound care, physical therapy, diagnosis review, previous hospitalization summaries, and even medication summaries. The possibilities are endless, and we're just beginning to go ahead and pass this technology around to our other CDAs. With that, I'd like to pass it on to Sardeep to share additional details.
Thank you, Mr. Steven. We didn't just upgrade, we stepped up. We introduced context engineering. LLM as a judge that Mr. Steven just mentioned was another game changer for us. I no longer had to be involved in testing extensively. The first 9 months, I had to manually review everything myself. When the MTech team had introduced LLM as the judge, it took a burden of constantly reviewing and testing away from me, allowed Mr. Steven to further refine the output by himself. This allows us to compare output, refine logic, eliminate insufficiency faster than ever before. One key insight we uncovered is the difference between the capabilities between reasoning model and the language model. Reasoning models don't just summarize, they understand the context, the nuance, and the clinical relevance. We revamped our testing strategy and brought in an additional case manager to validate summaries across condition of care, skilled nursing facilities, and home health concurrent review. The result, we achieved clinical accuracy in the concurrent review, cut time from 30 minutes to 10 minutes. This isn't just a technical win, it's a clinical transformation. It means more time for care coordination, more time with our members or their loved ones, or more time focused on improving outcomes. We achieved a major milestone. Staff were able to reallocate their time to care coordination, and the objective was reached. The shift didn't just improve efficiency, it enhanced collaboration across teams and disciplines. Most importantly, it led to meaningful impact in transition of care, ensuring our members receive timely, coordinated, and high quality support. This is the kind of impact that transforms not just workflows, but outcomes. This was a grind. We pushed through despite some challenges early on because we knew it could be done. The work is never truly done. The testing timeframe we developed to evaluate human versus AI generated summaries has evolved into continuous performance tool. Now we can run regularly to ensure our model remain accurate, reliable, clinically sound over time. It's not just about automation, it's about accountability, adaptability, and clinical excellence. We're now equipped to assess alternative models as they emerge, keeping our care delivery sharp, future ready. A heartfelt thank you to John Snow Lab for inviting us to this summit. On behalf of Mr. Stephen Weiss, we are deeply grateful for this opportunity to share our journey. I would also like to thank Ms. Corinne for Champion Mindset, Mr. Stephen Weiss, Dr. Waterman, Dr. Kroymans, and the rest of the MTech team for their Champion Mindset for getting us here. With that, I would like to hand over to my colleague, Mr. Stephen Weiss, for his closing remarks. Mr. Stephen?
Thank you, Sardeep. I'd like to remind everyone to always use AI responsibly and double check every output that is generated. With that said, I'd also like to go ahead and thank Dr. Kroymans, Dr. Waterman, Corinne, and Babul, and the rest of the engineering team over at Emerging Tech Department for all the hard work and contributions to this project. It would not have been possible without everyone's hard work and team effort. So thank you.